This is Tony. Good day, Dr. Morse. Good day, Tony. I have a question. My dad has an upcoming surgery in 2 weeks. Ooh, February 28th. I hope he can get this up to, he probably won't get this up till tomorrow, for correction of a spinal stenosis. He was diagnosed about 5 months ago after having x-rays and MRIs due to tingling in his hands with discomfort. Upper. He also has in a motorcycle accident about 8 months ago. And this is what we're talking about. You know, when you have trauma, when you have an accident, it has to heal. When you have weak adrenals, and of course the accident is going to dump your adrenals. So when you have weak adrenals and you have a highly acidic, lymphatically stagnant body, you don't heal well from these. And of course that inflammation from acidosis, from just not only the trauma and all the proteins that were broken down and sitting there, but all the acids from the cells in that area as those cells are continuing to function. So you have all of that that's building up in those areas. So what you see a lot of time, of course, is calcium being yanked out of the structure, be it the spine, be it the bones anywhere, be it the connective tissue. And so you can see why. And this is true post-surgery. This is true everything. You should never get anything but fruits, berries, and melons in the ICU, along with herbal teas, ingestion of herbs, IV therapy with herbs. You can pull all those people out of there in half the time, save these people's lives, and we make it such a critical thing. In which he broke his right shoulder and all the ribs on the right side. Now, what other thing would you look at in this man? Parathyroid. He has been feeling bouts of tingling and pain on his right shoulder and hand since. Well, again, when you have trauma and you have accidents like this, it would be great if you were directed to hit up on a detoxification program. You're cleaning out all the damaged tissue and you're moving that lymph, because it's going to go through the lymph. And if you can't, then you can't even remove the damaged tissue. So all these are a lot of proteins set up on more acidosis. And so these areas are just hard to heal like that. And then, of course, then you see, because it's acidic, to slow or curtail the acidosis effect on the surrounding cells, the body's going to try to use calcium. Well, what happens when calcium comes out of matrix, it ionizes in a different way, and you end up with calcifications and stenosis. Or it could be cholesterol, it could be lipids the same way. It doesn't matter which one. And then, of course, remember, what's the third thing? Yes, edema, water, absolutely. Yes, I have had experience with spinal stenosis. And I'll tell you, what would you have to do with spinal stenosis? Meaning, calcifications. You need to get what going? What system would you have that problem in, and why would you have it? Acidosis, lymph system, and you'd hit the kidneys and adrenals, and you really start cleaning that system out, which he needed to do right after the accident. And he could have healed many times faster, and he probably will have some healing crisis in that shoulder, no question. Wherever he's had trauma, he's likely to have some healing crisis in those areas because they've never really healed. And then if there's any nerve damage, the fruits and the berries and the melons, use the brain and nerve formula. That'll help to strengthen the nerves there. Any treatment for it other than surgery. Absolutely. It's going to take some work. Depends how much time he has, how bad he's getting here, how much compression or rupture or whatever's going on there. But to fix this properly. Now, remember that his whole body is going to be involved with this. So he needs to do this no matter what he chooses with the surgery. I'm worried he has never had anything of significance wrong with him physically and has been fit his life. Now here's an example of someone that's fit in his life, what appears to be fit, but he's not healing well and he's getting stenosis. That's not fit. It appears fit because a person isn't going down, they get up every day, they go to work every day, they do all these things, but this man isn't fit. This man has lymphatic problems, and therefore he's getting stenosis from that. Even though you can blame it on the accident, we're supposed to heal. Your body's a healer. There's only one way. Whether you use fruits or vegetables, okay. With bones, you can add the vegetables in there. Neurologically, you can't. So it depends what levels you're working at and where you want to go with this. We're into regeneration of the human body. Call it naturopathic, call it whatever. Doesn't matter what you call it. We're into the highest healing that I think that's out there. I haven't seen anybody out-heal us yet.